How are you going to manage weight loss when you're perimenopausal and your hormones hate you? Well, let's look at a practical guide. This particular article is Weight Loss Management Module for Perimenopausal Women, a practical guide for gynecologists. Okay. So at the beginning of the abstract, they're going to tell me that menopause has been identified as a high-risk stage for weight gain in a woman's cycle. And they're going to continue to say menopause-related weight gain is a consequence of low circulating estrogen levels due to progressive loss of ovarian function. Moreover, the changes in the hormone milieu, chronic aging, decline in physical activity, coupled with Western dietary patterns, screws us. So this article just continues to get fun. So we have emotional eating episodes associated with psychological distress also increases our body fat. I mean, I don't know that they're wrong, but I feel like it's very offensive when they say it like that. So this contributes to an increase in total body fat and waist circumference, which we know that waist circumference means we have increased visceral fat, which increases our risk for cardiovascular disease, which is the number one killer of women. But, oh, wait, they go on to say that high waist circumference is an independent risk factor for cardiovascular disease and metabolic disease in menopausal women. Because visceral fat is different. It is a metabolically active fat. It's like an organ. So they're saying that they can help us by effectively managing us, which means if they help us lose weight through lifestyle modifications, behavioral lifestyle interventions, in using counseling to help us correct our diet, change our physical activity levels to help us get a sustainable weight loss. Majority of menopausal women seek this counseling from gynecologists, especially in the primary care setting, due to non-availability of a multidisciplinary team. Okay, so I love what's coming next. I don't know if you have felt like you could eat everything under the sun since your hormones changed, but here we go. The mechanism of development of obesity in menopausal women is outlined in Figure 1. I'll show you that later. The continuous depletion of the follicular ovarian pool during menopause transition lowers estrogen production with a relative increase in androgen levels. The hormone imbalance alters energy homeostasis by regulating hunger and satiety signals. Estrogen inhibits the action of hunger signals, preventing events of excessive calorie consumption. It is postulated that during the menopausal transitioning, because of the fluctuating estrogen levels, its effectiveness to modulate hunger is reduced. Menopausal women experience more intense hunger signals, encouraging increased food intake, which promotes weight gain. It's my life. So that particular profound statement is from this article right here. So let's continue on. They are also stating in this article, because we are more tired, we are burdened, we are busy, and so we start to develop a sedentary behavior in middle age due to diminished muscle strength that limits their functional ability to perform everyday tasks. Remember, I told you we're losing muscle bulk, so now I'm tired because I'm less strong and I'm not able to do all the things I once was. The limited time spent in daily chores and physical activity is compensated by involvement in sedentary behaviors such as watching television, reading, and talking. More than half of 64.7% of Indian women follow the sedentary lifestyle. This particular article is based out of India, which I have found I really do enjoy their articles because they do a much better job tracking than we do here. Next line, a little grumpy, but it's true. Besides, these women rarely adjust their caloric intake according to decreased daily activity, making them gain weight. I don't think they just called me lazy. I don't think so. That's what I heard, but it's not it. What it is that I have less muscle bulk, so I'm more tired. So I want to sit more, which means my metabolism is changing and I'm not modifying my calories. The article that gave that bomb fact is from the Journal of Menopause, came out in 2018. So we're going to keep learning about the grumpiness of menopause. So we become overweight, we become obese, we're at a greater risk of metabolic and cardiovascular complications, we're at a greater risk of osteoporosis and cancer. The risk of metabolic complications is compounded by abdominal fat distribution. Intra-abdominal fat around the viscera acts as a metabolically active tissue, like I said, producing inflammatory markers, interleukin, leptin, tumor necrosis factor, which regulate the metabolic factor. Besides, studies suggest that higher abdominal fat is positively correlated with hypertension, insulin resistance. It's just not good. Just not good. Now, this is where it gets good for me as a physical therapist, because I see this in my practice. A majority of women during menopause also complain of bone-related issues such as joint and back pain, knee-related issues, osteoporosis and fractures. Yes, widespread joint pain. And somebody could try to diagnose you with fibromyalgia, and it's not that. You're perimenopausal. In most of these cases, the degenerative changes in the bone are driven by a marked decrease in circulating estrogen levels. Do you hear what I'm saying? So let's continue. The depletion of the levels of estrogen enhance bone reabsorption without a corresponding rise in bone. We're getting brittle snips. The amount of bone reabsorbed is greater than the bone deposited, so basically we're weak little things, and this reduction in bone strength predisposes menopausal women to bone-related issues such as osteoporosis, exposing them to a risk of fracture. A later premenopausal stage, higher BMI is an independent risk for breast cancer, endometrium, and uterine cancers. Obese menopausal women have a long-standing exposure to estrogen due to its continuous production of adipose tissues. Okay, so we're going to continue on in this particular article, and I think this is real strict, and I don't know that I agree with this, but here we go. So a calorie deficit is achieved by reducing 500 to 750 calories from your current intake. In general, an intake of 1,200 to 1,000 calories is suggested in clinical practice. No, I'm not a toddler. I know I have got chunky, but I'm not a toddler. I don't support this. But you know what I do support? Protein and fat. And if you look at the leaders in menopause right now, the women that are actually talking about diets, they're talking about 30 grams of protein per meal and having increased fiber and having less carbohydrates. So I'm not so sure about this. The recommended diet should be high in fiber, as the antioxidants in fruits and vegetables. We know this. We know that there needs to be water. We know that there needs to be limited processed foods. But I'm not buying the caloric intake of a toddler. Now, here's something I have heard over and over again. I have it highlighted in blue, and this is really important if you are not increasing your fiber in fruits and vegetables. The recommended diet should be high in fiber, as the antioxidants, especially from fruits and vegetables, decrease the oxidative stress that affects the number and quality of ovarian follicles. Okay, you are inflamed because estrogen was buffering your inflammation, and you absolutely need antioxidants. You are a fast rusting vehicle. We need green tea. We need blueberries. I agree with this 100%. I just can't get behind that low calorie. I can't. I just can't. I can't. But I can talk about nutrient dense foods and why you want to have more antioxidants. So let's get to your activity levels. So menopausal women are generally advised to exercise 150 minutes per week, but it also talks about incorporating resistance training 2 to 3 times a week to maintain bone and muscle mass. I cannot scream this loud enough. Weightlifting 3 times a week, and it doesn't have to be big weights, makes all the difference. I need you eating your vegetables, lifting your weights, walking. It matters. But also, don't forget to practice yoga, because I need your cortisol to calm down because you are stressed and inflamed. So yoga, I love yin yoga, specifically will help you calm your nerves and modulate that nervous system. But it has also been shown to relieve hot flashes and improve sleep in late perimenopause and menopausal patients. So here's how I want you to start exercising. Step 1, let's become more flexible. Let's stretch. I made a video about stretching. Number 2, I need some aerobic exercise. I need you to walk. Number 3, we have to do our strength training 3 times a week. Number 4, I need you to start doing that yoga 3 times a week for 50 minutes will help reduce your visceral fat. Number 5, working on balance exercises such as yoga, single leg stance, will help prevent you having any falls because your brittle snips a bone. I don't want you to fracture a hip, but movement-based therapies such as Tai Chi, Pilates, yoga will help. Number 6, exercise sessions should conclude with cooling down. Okay, listen, you're already going to be walking. We got this, right? So I want to remove every single barrier. Now I need you ladies to make a plan, commit in your schedule where you're going to do this, because I want you to have the greatest success. Take away the barriers.